Okay, guys, hello, good morning. Today I have a special, awesome guest, wonderful nurse, been a nurse for a long time. He knows his stuff, Mr. Charles Drummond. He's the clinical nurse manager of Meritus Medical Center, and his focus is mainly behavioral health, even though he's been a nurse a long time, other arenas as well, but behavioral health is where he's focused on right now. So welcome, Charles. What's up?
How are you?
Pretty good.
Not much. The day is my birthday though.
Oh, happy birthday to you. Okay. And you took time to spend with me. Oh my God, I am honored. Right now I feel special. Okay, so tell the students, first of all, why you even became a nurse. What made you come into this field?
Wow. So anyway, I started out when I was 18, I joined the military.
Okay.
Far from being a nurse. I was a field artillery, so that's basically the same thing as infantry. And knew nothing. I had a roommate, and he told me he was getting out and he was going to become a nurse. And I looked at him like he was crazy. I said, they don't have no men as no nurses. Where you coming from with this? And then he just started talking. I was like, yeah, good for you then. I thought something was wrong. So
okay.
And he went on his merry way. I hadn't heard from him since. And when I got out, I went to the National Guard, and somebody brought up the idea of we need LPNs in the service. This is when it was a really big need for nurses. So I said, maybe somebody's trying to tell me something. This is the second time I heard it. So I rose my hand, and that's how I got into it. And it seemed like it was a calling. I didn't even know how much money I was going to make. I would have been satisfied with $9 an hour.
Whoa.
As an LPN. So
okay.
Well, so when I got out, the first job I had, it was making $11.50 an hour.
But what year was that? Because that
was in 94.
Money was worth more. Yeah.
Oh, that was in 94. So okay. I think we could have been paid more than that in 94.
Yeah.
When I graduated, I took a job making $11.50 and worked my way up from there. So yeah.
But that was an LPN, right?
It was LPN.
Okay. So I don't know a lot about that, but when you became an RN, which is really close after that, what was
right? And, yeah, and it was just that I saw that as an LPN, there was not a whole lot of upper mobility.
Exactly.
All you were going to be was working in the nursing home, and I wanted more out of it. So I went back to school. The school didn't come very easy for me. I had to work very hard, and but I had to when I got through. I was very happy, but unbeknownst to me, it was more stress. It's much more stress being an RN than it is an LPN, and so forth. You're responsible for so much more. I
feel like I'm in the church. I'm about to say preach, but go ahead.
Well, yeah, but it's the
so
truth.
And so telling the truth.
It's a lot of responsibility in being a nurse if you take it seriously and you really care about the patients and you want to do the right thing. It's a heavy load to carry, but you feel so you get so much out of it as well. So it's a lot of self-gratification, and you get to be personable with people, and it's fun. Some of the things I like, and I didn't have to become a nurse to do that. So, but I'm glad I could use those talents in this field.
Awesome. So why behavioral health? Tell us something.
So behavioral health. I did ED. I did a whole lot of things. But the first job I had was with a group home, a bunch of kids that came from some terrible backgrounds, and I just had a whole lot of fun talking to them and being the big brother or giving them advice, and it just, I don't know, I guess it just spawned from there. So but even though I didn't even get into mental health after that, I went right into the long-term care. So I just use those skills everywhere I go, and the same skills I use in long-term care, the same skills I use when I worked in ICU, ED, are the same exact ones I use in behavioral health. And I think, it's just made me a really good, I feel like I'm a good nurse.
You are good. I've got to work with this guy. I've got to work with him. I got that privilege at least, maybe 2 or 3 times, maybe.
Yeah.
Somewhere in, what year was that? This is 23 now, so last year.
That's right.
And he's awesome, guys. He's wonderful. Yeah.
Yeah. So I'm not stuck in behavioral health. I think that I'm much more useful in behavioral health, and I feel like I've been more helpful to people here. Behavioral health. I've been to so many different places, and I think the most fun I've had was when I was in the military as an LPN and working on the different departments there, because you work everywhere. They don't even care. You need to go. You work in an ICU today. So I picked up a lot, and I just learned to just do what I have to do to get by. And I'm not the expert in everything,
Right.
but if I have issues, I know where to go find them and do the right thing.
So just do me a favor here. Tell them, since you've already worked on multiple other units as well, let the students know the huge difference, in your opinion, between behavioral health, a unit like behavioral health, versus a med-surg unit, ER. Well, let's don't compare it to ER. Oh my God, ER is everywhere. Like a regular med-surg unit.
So I don't know if it's good or bad. I guess it depends on your typeset.
Okay.
When you work in med surg, things are protocols. For a broken leg, this is what you do. For a wound, this is what you do. If a person has a UTI, this is what you do. This is the antibiotic you use. If a person comes in with pneumonia, in the ED, you have to start the antibiotics. It's after you get your blood cultures, blah, 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 blah. Everything's protocol. It's written. As in psych, you have to think out of the box.
Mhm.
So you have to be constantly changing the way you do things. You have to constantly self-assess, because you don't know where this person is coming from. You don't
Mhm.
know what they're dealing with. And you can't handle a situation the way you handle your own situations, because this is a whole totally different person, a whole different mindset. So you're going to have to be accepting of a lot of things. Um, mental health is changing and changing as you go, and you can offend someone very easily in mental health, very easily. It is the most underserved group out of all the other units. You're dealing with addictions, you're dealing with everything, and also the unfortunate thing is everything is thrown on one unit. You're dealing with depression, schizophrenia, psychosis, all in the same unit. So if you can just imagine having an old lady that's depressed that her husband just died, and then you have this guy that's 250 pounds and he's psychotic, and how you have to coordinate that to make sure everyone is safe, everyone's getting proper treatment. I think it's probably the most mentally challenging area that you would be in.
Right. Yeah. And
My opinion.
Yeah, and just add too that he's also dealing with people with multiple personality disorders, people that's bipolar. You don't know if they're up, they're on their high that day or they're on their low that day. So you kind of have to adjust each day with your patients, and each patient is in a different realm.
Oh, yeah. Yes, people look at mental health.
Yeah.
They think it's easy, but
It's not.
if you think it's easy and you don't know what you're doing, it could be the worst day of your life.
Right.
in this hospital. But when you know how to handle things and you got your wheels turning where they need to be, it could be a real good, fulfilling day.
Yeah.
But we do have our days, especially when someone just makes one wrong word and it's over. So yeah, so that's the biggest difference. As far as the skill set, when you lose your skill, when I worked on the med surg units, I never lost any of those skills. I'm not gonna say I'm just as fast or just as efficient as a med surg nurse, but after a couple of days getting back in the groove, I haven't lost anything.
So one thing I'm going to add, just for the students who haven't really come out into the field yet, so they, trying to give you even more of a comparison, using the med-surg units and other units, you're actually really at the bedside per se, doing one-on-one, touching the patient, and whether it's wound care or bathing them or whatever. And psych is a little bit different. A lot of times you're not even in the patient's room, correct?
Correct. But you can find yourself at the bedside a lot of times, because it depends on what level of care that you're in.
Right.
That somebody's child could be dying, anything. You could be right at the bedside. You may have to hold someone's hand.
Right.
But I haven't. We try to avoid those situations as much as possible and try to take care of things before they get to that level. But we do whatever what is called for us to do, because we're the main point of contact. The doctors have their job and we have ours, and sometimes we have to think outside of the box sometimes. So we find ourselves in situations that may be different,
Yeah.
you know.
Yeah.
So we could be at the bedside. Don't think not, because we have people that are total care that come in on the mental health unit. So we're at the bedside. You might have to catheterize somebody. You never know. IV. You never know.
Right.
And definitely I am. So
Oh my God. So what type
so,
of unit specifically are the ones that you're not at the bedside and they're coming out to get their medicines at the front desk and everything
mhm.
like that? Tell the students a little bit about that type of psych.
So yeah, usually a lot of places have gotten away from the patients coming up to the window, but there's a nurse's station and there's a window because someone could come up and ask for a PRN.
Mhm.
But they prefer nurses now to be more involved in what's going on the unit per se, because you can get into a habit of being away from the patients, because they have if there are no groups going on and or anything like that, nurses find themselves behind a nurse's station not interacting with the patients.
Mm.
So nowadays we want the nurses to be more involved in what's going on
Yeah.
out on the unit. So we're out there with the patients. So if they have any medical, what they say that I'm anxious, is there something I can take as a PRN? We're out there on the floor, so the patients are not looking for us.
Yeah, a lot has evolved in the last 10, 20 years.
Right. We're
From
right
what I've
there.
seen when I started 2 decades ago.
Yeah.
But that's
So
awesome.
yeah,
Wonderful.
yeah. So all of our nurses, we have our nurses station, and when you come on our unit, you won't find one nurse behind the nurses station unless they're going to get a medication.
And that's not all facilities, guys. I'm just telling you. But that's awesome.
Well, in the hospital
Yours
as a
is
whole,
taken up to a new level, and that's awesome for them. That's a wonderful, wonderful,
right? The hospital as a whole, this
a good hospital.
assaults are bad. That's like probably one of the number one things.
Mhm.
But when you factor in behavioral health, you can see where you can have an increase in assaults because you have psychosis and you're dealing with a lot of different things.
Mhm.
So we had 76 on our behavioral health unit last year, and since then we've had like 25. And I think the biggest change is us being out on the floor and being involved.
Yeah, more
24/7,
interactive.
being
Mhm.
more interactive. Absolutely.
That's awesome.
So yeah. I
So
didn't mean to take over. You go ahead.
no, I love it. Oh my God, I love it. This is thing, guys. I asked him on this show because for my students, because I did psych nursing with ER. So as you guys know, especially I know he knows that sometimes in the ER you have a whole separate unit for your psych patients. And even if that's not a psych hospital, they have what we call a layover or a holdover. So that person still needs to be evaluated by the case manager, whoever is coming to see this patient, and deciding what hospital they are going to be going to, which is best for them and their care. And a lot of times on the weekend, that doesn't happen a lot. You have to wait until Monday. So I may have a patient maybe Friday night and they're with me that whole weekend. So I did that type of psych nursing, which is still a combination of everything, but they're deciding which type of hospital they should be in and what type of facility they should be. If that's not, my hospital was not geared for that specifically. So we kept all of our psych patients in the ER unit. But this guy, he's psych through and through, in addition to tons of other levels of nursing, and he's the manager, for goodness sake. I mean, he knows his stuff. So what better person to have on here but Charles? Yeah. Thank you again, Charles. I know you took a lot of time out of your, oh, it's his birthday. That's right. Happy birthday to you. Oh my
Yeah.
God.
I
Okay.
mean, we done already. Oh my
One
goodness.
last thing. I just want you to give words of advice, or what you think the best word of advice is for a fresh new grad, just came out of nursing school. They have their clinicals, obviously, but they haven't gotten their feet wet yet, really on any real particular unit, but they want to go into psych. What advice could you give them for that? Oh,
So if they want to go into psych,
and they haven't had any
I
previous
think that
experience anywhere else.
right, and I think that just being observant is the number one thing. Um, Taking it in, take your time, because you can get run away from the profession very easily. I don't care what profession you're going, ICU or what have you. This is a very challenging area to get into.
Can you give them an
It's
example
very
of
rewarding.
challenging? Give them an example of challenging, because
So, like you said, they have no experience. So, my thing, as far as how I feel like I've survived, is I've learned how to be a good team player. And if you're lacking team player skills, you better get on your job,
you
because
know,
yeah, because when the
so true.
nurses find out
In
that you're
every
not,
unit, every unit.
when they find out you're not a team player, they're
Mhm.
gonna just sit back and say, okay, it's gonna be your turn one day. We're gonna see, and
Right.
you're gonna be stuff is just gonna be flying everywhere for you. And we as nurses, we help out each other, and you can
Well,
see the
one big
better running
family,
you have.
guys.
That's
Family.
right. Yeah. And once you got a couple of good nurses that you know on your side, they got your back. It makes it so much easier to walk into work that day. And it's gonna make it so much easier when you leave work, you know.
Yeah.
So yeah, I would say that would be my best advice. And put all your personal issues behind you, put them in your back pocket when you come to work.
Check it at the
And
door before you
that's
walk in
right.
the building. That's what I do.
And and get
Check
on
it
on
at
with
the
it.
door.
Get to know your nurses, because I don't
Yes.
know where you guys are from, but in this area where I am, we have people from all walks of life. And the most important thing is us getting to know each other. Find out, if you don't know a particular person, find something out about that person, and develop some kind of a relationship, because it's a very difficult business. It's
Yes.
not easy. And don't think you know everything, because you
Oh,
don't.
you'll never know everything, guys. You're always learning, you know. Oh
Yeah.
my
So
gosh.
that's it. That teamwork, and always learn new things on your own. Don't wait for the facility to teach things.
Yeah,
That's
be
the other thing,
proactive, guys.
because things change. We're second probably to the computer field, and you know how fast things change in the computer field overnight.
Overnight.
And when you're a nurse, we walk hand in hand with them. So things change. We're always finding out better ways to do things, and things we didn't know. So always stay up on the latest.
Just
And that's
curious,
it.
at Emeritus, you had a fresh new grad coming in. How long is your orientation program for a new graduate?
So yeah, they have a nurse residency program, and that is a year long.
Mhm.
So at least 6 weeks of orientation on the unit. And even after that, they're babying you along. If you don't feel like you're ready to take a full team, they'll give you more time. Um, but the thing is, we're working very hard to keep nurses in the field. This is why we have that nurse residency program. And so yeah, so we work real hard at it. We don't push people over the edge. We do what we need to do to get them ready.
And here, guys, just so you guys, well, the students should know this by now, but the nurse residency program is a state mandated thing as well, especially for
Oh,
teaching hospitals. I mean, I graduated what 98, and you graduated what from RN in 97, but he was a nurse before that as well. That wasn't a mandate then, but it is now. So, which is actually a good thing for you guys. Is going to really help you to zone in on your skills and get all the assistance you need, where we were kind of on our own, you know what I mean? So either you knew your stuff or you didn't. So yeah. So that's awesome. That's great to know.
okay.
Thank
All
you
right.
so much, and happy birthday again to you.
I appreciate it. And if
We
anything
could
you
have
need, let me know.
rescheduled. Oh my God, this is your
No,
birthday.
no. I stopped having birthdays a long time ago, to be honest with
See, he's a typical nurse. You're like, holidays, what's that? Birthday,
you.
what's that? Everything is about our patients, and hospitals never close at 24 hours, 7 days a week. So
That's right.
someone's got to be there, birthday or not, holiday or not.
Somebody has to. Somebody got to be here.
You can't just
Yeah,
be empty hospital. Everybody to the left, we tell the patient, we see you when we come back. It don't work that way.
that's right.
Jobs that close up completely on holidays, we can't do that.
Okay.
Nice
So,
seeing you.
all right. I appreciate it.
Thank you so much. So, guys, I know you appreciated having him. I did as well. And thank you so much. And we'll see you next time. Okay, take care.
Bye bye.